My name is Sona Nevsimalova. I am professor of neurology for pediatric neurology as well as for neurology of adults, and I'm involved in research of alternating hemiplegia maybe 30 years. We published at the beginning of 90s the first article, and it was reason that I was found as a possible researcher, and I was involved in the research in the international field. I think that we were very interested in the course of the disease in the beginning. And we were thinking if there are some epileptic changes. We had a lot of examination, for example, EEG during the attack, EEG beside the attack, electromyography during the attack. We have a possibility also to do some bioptic examination of these patients, and we found some alteration in some biochemical spectrum of the muscles enzyme. We were very surprised about it, but it was surely secondary. Also, we had a possibility to saw the attacks on the neuroimaging methods. For example, before the positron emission tomography, we used SPECT, a single photon emission positron tomography, and we had a possibility to see, for example, quadruparesis of this patient, hemiparesis, changing one side, second side, that it was very, very interesting for us. We had a lot of meetings before. For example, one of the first meeting was in Roma. It was maybe 15 years ago. And then 10 years ago, it was one very interesting meeting in Scotland. And I attended also a lot of meetings with NRAH, with Sveta Singhs, with Neuropet and so on. And of course, the discovery of a new mutation is a very, very huge thing, because we found all the patients. We asked to come to taking blood, and we were very surprised about the results, because we have several relatively benign patients who are now almost 40 years old, and they are maybe in a rather good condition. But we found also not in Prague but in Bratislava one patient who is very, very severe. He cannot sit, he cannot walk, he cannot talk, he cannot do anything. He has very, very severe epilepsy and heavy severe breathing difficulties. And it was the most severe mutation. When I was younger, my chief, the name was Professor Dietrich, and I think that I don't know how the first patient came to our department, but we found patients from the whole Czech Republic. We have patients from South Moravia, from North Moravia, from the whole Bohemia, and so of course during this time we lost some patients, because as I remember, 2 or 3 died. One was only 12 years old. He had severe pneumonia, and he died during this illness. And then one older girl, she was approximately 40 years old. She was very severely affected. She had very severe dystonia, also dysphagia, and very painful dystonia. And unfortunately, when she died, the autopsy was done on the other diagnosis, on the cerebral palsy, and we don't know anything about it. And we lost probably also one from the older patients who who was also approximately 40 and something between 40 and 50 years old, and he was from the north of Moravia. But he had some older as well, and I think that he are now in a better condition. The oldest are almost 40. He is now 38. I think that it's very important to correlate the genotype only, not only with the clinical phenotype, but also for the severity of the auxiliary examination with neuroimaging, neurophysiology as well. And as I remember, there are also maybe 1/3 or 1/4 of patients who are clinically like alternating hemiplegia, but we don't know the gene. And I think that it's very difficult to devote our attention also to this group who has no gene at the present time. I think that with treatment is a very, very long way, because the flunarizine was one of the first drug. It is used for, I think, 20 maybe years, and still it's one of the best drugs that we know. I was asked several years ago about the sodium oxybate. It's drug also not new, it's old drug. It's used in narcolepsy, cataplexy, because the cataplectic attack, there are some similarities between paralysis in alternating hemiplegia and cataplexy in narcoleptic patient, for example. Also such surprise or some stress involved the attack. But there are now some trials of sodium oxybate, I know, in Canada and United States, but I don't know the results. I am afraid that it will be not some very, very strong drug against alternating hemiplegia, but maybe that can help in some patients. I think that Alexis Arzimanoglu has a very good idea about the consortium, international consortium, because there is maybe more than 10, 13, 15 countries that would like to add, and I think that it will be a strong idea to push the research a little forward.